Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about diabetes and smoking cessation, and joining me is Cassie Clayton, the Director of Nursing at Morton Comprehensive Health Services. Welcome to the program, Cassie.
Thank you.
Now, before we begin, let's sort of talk about diabetes in general. How much of a problem is it in the country today? Adults, youth, we hear a lot about youth and obesity, and they're developing what used to be more for adults in terms of diabetes, but what are you seeing?
There are two types of diabetes. There's diabetes type 1, which children are, it's usually children that are born with this diabetes. And then type 2, which is the one that is most prevalent because of our weight gain, because of our diets, changing and us being such a fast-paced nation, generation, or whatever. We are starting to gain weight, which is leading us into wearing out our pancreas, which leads to, the diabetes. The symptoms of it, usually are classic, excessive thirst, weight loss, unexplained weight loss, and then excessive urination. And then sometimes we have frequent yeast infections also that lets us know something is wrong. And usually when we start to have these symptoms, and that's usually what takes us to the doctor that says, I've lost this weight and I don't know why, and that's concerning. And so we do a test then to find out why we are having these symptoms.
Now, when we look at children then, because sometimes our children wouldn't necessarily, especially if they're active in sports, etc., there could be some weight loss, things such as that. How do we as caregivers sort of monitor our kids? Because especially those that may be a little bit overweight, but of course you can have diabetes and not be overweight.
Right.
But how do we sort of monitor or talk with them about what signs or symptoms they need to be giving us? Because like when it's hot, you're in sports, to have more thirst, well, yeah.
Right.
To urinate more because you're drinking more, well, yeah. Sometimes the weight loss with sports, but it could be a diabetic issue.
But with children, if children with diabetes, it's a different type of diabetes.
Okay.
And so children, usually what we are looking for with children whenever they're complaining of just not feeling well. Okay. So they're not having the same symptoms as is classic as our diabetes type 2. They're having symptoms of it's a sickly, they do have the weight loss, yes, but they also are just not feeling well. And then the frequent urination, yes, does go along with it. But with them, with this being two different types of diabetes, this is not one that's caused by their weight gain in children.
Okay, and in general for kids then, like I say, when you're starting to see just a change with some symptoms, or like you said, they may be more tired or just not feeling well, just generic symptoms, you still should go in and get them evaluated.
Yes. If they're laying around and they're changing from being active to just kind of laying around all the time, and younger children, even younger than teenage. I'm talking about, because children children that have diabetes are usually, they have to be they're insulin dependent, meaning they have to be put on insulin, but their symptoms are not just where they're because they're outside playing and they're active and they're tired and they're laying around because it's summer and they're off of school. You'll notice a considerable difference in mainly that they're not feeling well.
Okay, now when we think then about diabetes with children, what are some of the things in terms of diabetic education? I mean, we get really confused with normal nutrition, much less diabetic nutrition. I mean, are there some distinctions of what you would be teaching people or want them to know as far as kids or older teens as far as what they're consuming, or is it still back to just good nutrition? I mean, exactly what is it these days? It
is still back to good nutrition. What I learned in teaching this class is that there is no such thing as diabetic food.
Okay.
It's a carb counting, and so when we keep track of our carbohydrates, that's how we learn to calculate what foods and how much food that we should consume. And so it doesn't really have to do with so much a diabetic diet, so much as it does have to do with the counting carbs. And with children, it's funny because children learn easier than adults. They learn to manage their care easier, maybe because they're so receptive, to learning, but they learn to manage it a whole lot easier than adults. I think because with adults they haven't had this and it's progressed. It's something that has happened, you know, over a time. And whereas with children have there's certain types of equipment that they can wear. Like there's an insulin pump that they can wear that helps them it regulates, you know, the insulin that they get for them. It can be programmed, and so it regulates the insulin for them. But as far as the diet, they learn better, and they learn how to do the carb count.
Now, when we think about carbs, help us with that, because sometimes we get kind of confused with what kind of foods are foods that have carbs in them, you know, carbohydrates. What are we looking at? Okay,
so carbohydrates are it's where our body breaks down sugars, and just about everything that we eat it breaks down into a sugar, which is a sugar is the carbohydrate. If we're eating fruit, that breaks down into fruit, you know, fruit sugars. If we're eating vegetables, that breaks down, you know, everything breaks down into certain. When it breaks down into it's the least how am I trying to say what foods are made of. It breaks down into that factor. And so, like proteins, we usually think of proteins that we get from meats. We think of in our vegetables in terms of our fruits and vegetables, but usually we think of carbs as being the sweet things that we eat, and it's not always. We can get carbs from breads. We can get carbs from like pastas and things like, you know, things like that. And so when we're talking about our carbohydrates, they come from the sugar sources of where our foods break down into these certain sugars that our bodies use.
So reading labels, is that like a big component of what you teach teens, I mean whoever may have diabetes, to do? Is that really critical, because you kind of don't know maybe where a carb is in terms of what you might normally think?
Absolutely. We have a nutritionist who helps them who teaches them how to read labels and to read carbs. And so we teach them the very basics that 15 grams of carbohydrate is 15 grams of carbohydrate. And so when they're breaking their foods down, when they're looking at these labels and they're breaking their foods down, then they learn that 15 grams of carbohydrate is 15 grams of carbohydrate. It's the same, you know.
It's the same.
Yes. And so when you look at your labels and you see there's 30 grams of a carbohydrate in something, then of course then you have 2 carbs there. So you're dividing these 15 grams of carbohydrate into however many carbs are on that label. So they learn to read the labels to learn how many carbs are in, and then how to break that down into determining how many carbs are in that certain food source.
Okay, now do you recommend that, like for school-age children, because sometimes that's a big concern of parents, should they have to send their lunch, send their snack? I mean, how do you work with that concept for kids?
It's better if they do send their lunch, because usually our kids will they'll go to the fast food area, and lunches are changing in schools. But it used to be that, you know, when I was in school, you had this cafeteria food, and that was it. That was your choices. And then we went from that to having choices. There was fast food, there was the cafeteria food, there was the salad bar. So we went from that, where my children had choices, and now we're getting back to where we have cafeteria food, because we're thinking healthier for our children. But as far as lunches go, it's better if you do send a lunch with them, because then you know, and kids are going to be kids, you know, they're not it may be that they don't eat what's in the lunch. So if you have them help you to make the lunch, then they're more apt to eat what they had packed, you know, for lunch. Having them help, and that's the way that they learn what things are good for them, is you're having them help to make the lunch, make the choices, the food choices that they want.
That they're doing. Okay, we're going to take a really quick break and come back and pick up on a few other points, and also get into smoking. Okay? Please stay with us. We'll be right back.
Pants. I am folding the pants. Do they go on my head?
Everyday moments can become teaching moments, because learning starts long before school does. Give your child the start they need at bornlearning.org.
Welcome back to continue our discussion talking about diabetes and smoking cessation. Joining me again, Cassie Clayton, the Director of Nursing for Morton Comprehensive Health Services. Now, let's look a little bit at adults and diabetes, because you were saying that adults don't learn quite as well. I mean, we're maybe a little more hesitant because we've maybe not experienced good nutrition, or we didn't know we had it, or things such as that. What are some of the things that you see challenges for adults who develop diabetes?
Usually the challenges that I have noticed whenever we're doing our classes is that the challenge with learning how to use the glucometer, and of course the one of learning how to read labels. That seems to be one for our clients that they're most anxious about, is learning how to read those labels, and food portions, learning the sizes of food portions and changing those habits. That's the challenge for adults, changing the habits of the food portions that they're used to eating, because you can ask, how much did you eat? And it may be that, the answer may be, I had one plate of food. Right. And one plate is not, one plate could be a big plate rather than the portions of what was on that one plate.
Now, how do you help adults, especially with that concept? Because not only in the home setting where, and do you have to get into measuring? Because sometimes people aren't so successful if they have to measure and weigh. Do you get into measuring concepts? Do you get into sort of, we've heard about the plate, how you can proportion the plate into thirds or quarters or something like that? Do you get into the deck of cards and your meat in the hand and the cup, and I mean, what do you help them do to try to get a hold of that?
We bring some samples of foods in, and we show them. We do use measuring cups. We have a registered dietitian that comes in, and she's the one that does this class, and she uses measuring cups. She shows them how to do that, and we absolutely use the plate as the example, and dividing it into thirds and letting half of that plate be vegetables, and then 1/3 of that plate be meat, and then the other third being the side of whatever other side that they're going to have. And she uses food samples. She shows them visuals. I love the visuals that she uses. She uses a deck of cards. You talked about that. She uses, tells them about a deck of cards. And then also she uses the palm of the hand, the palm of the hand, and then she also uses the fist, size, but measuring cups, and she encourages all of them to get a set of measuring cups, because what we think is one size turns out to be something totally different when you actually use a measuring cup and you put that into your plate. But the best visual that I love is the one that she uses, the plate size, which is what we've changed now from that food pyramid to the plate size.
Right, which was more confusing. Now with the measuring cups, let me ask you this, because people may be wondering about this. If they're going out to eat, does your clientele report success in taking these measuring cups, and when you get your food, actually measuring out what you need, or is that where you tell them to rely on the visual size and kind of move certain, you may take some food home, right? But move those portions back until you can look at the picture of the plate.
Absolutely, we teach them to rely on the visual, to practice using the measuring cups at home, and then rely on the visual when they're going out to eat. And always, portions are larger, and so it's okay to split the portions. Take half of it home and eat half of it while you're at the restaurant. That's absolutely okay to do. But learning that visual, for instance, when you're doing that half cup, in my mind, a half cup means one thing, but when you actually put it in,
it's not very much.
No, it's not very much. It's not very much.
And when they want to talk about that as a normal size of ice cream, I'm like, oh man, I might have to have my 3-day supply in one day and just skip 3 days.
And we teach them that as well.
Can we do that?
Yes, yes, you can do that as well. That if you're going to have your, it all depends on what you want to have now and what you want to have later. So if you're going to use all of your carbs up, for breakfast, then you're going to have to modify lunch. You're going to have to modify dinner. So in the carb counting, that's what the dietitian teaches them, that they're going to have to modify. If they want to use all of their carbs in one meal, then they need to realize that the next meal is going to be lighter, because we've used all our carbs in having what we liked.
Now let me ask this, especially for adults, with our soda pops and juices and things like that. Well, we know the soda's not that healthy, but juices, people always say those are really healthy for you, but do they have to still do the same kind of label reading and just stay away from regular soda pops, and the diet is okay soda pops? I mean, how do you look at the drink component?
Diet is okay, and you look at the drink component in size, and so you're looking at the amount of, how much is in that size that you're drinking, and the serving size. That's the main thing that you want to look at. you have to look at how many servings are in that drink, you know, that you want to. So the juices that we usually buy that are over the counter, most of those have 2 servings. Not very many of them have 1 serving in them.
Most of us think that they have 1 because it's 1 bottle.
Exactly.
But sometimes when you read the label, it can be 2 or 3, and it's like you have to multiply it by what it's saying.
Yes.
120 calories or so many carbs per serving.
Right.
Because this could be a mega drink.
Right. Yes, so if you're looking at the serving size and the amount of carbs that are in 1 serving, that's how they're taught to manage their drinks. It's whatever. It's their snack, their drink, their main meal. That's how they're taught to manage those.
Okay, let me ask this one, because in our last segment we'll talk about the smoking, promise.
Okay.
If people get in trouble where there's a diabetic incident as far as a crisis, tell us about the different types and what are some of the symptoms that people need to be aware of so that if they're experiencing it, they know what to do, or if others are seeing that, they know what to do.
Okay. Most common is low blood sugar. And so we teach the symptoms of low blood sugar. It's that, you know, that irritability or feeling faint and feeling, you know, that I'm going to pass out and those types of things. And so we're teaching that if you are, you know, if you feel like your blood sugar is low, then if you're in a place where you can, check it, of course. And then we also teach that you keep hard candy with you, keep juice with you, keep protein, you know, some type of protein.
Like peanut butter crackers?
Yes, peanut butter crackers is fine. And do you know now they have the servings of peanut butter in those little single serving sizes now. So you can actually slip one of those in your purse and have that available.
Okay.
The thing though is if you want it to come up real quick, you're going to need something like a juice or a hard piece of candy, a sweet that's going to bring it up real quick. Now it will bring it up real quick, but it won't sustain it. Okay. And so you're getting it up so that you can do something then about eat a meal or whatever it is that you need to do to take care of it. Okay. Because you want to bring it up and then take care of it. As far as the having a really high blood sugar, yes. Some people don't realize that they even have diabetes because they've had it over a period of time and their body has compensated. And the test that we do, that hemoglobin A1C, is how we usually know because it's an average over a 3-month period of time. It can tell the provider, the clinician, what your body has been doing over this 3-month period of time, give them an average. But most people there's symptoms with that if it's getting too high, and some people are starting to act like they are confused. And so they're kind of almost sometimes the same symptoms. They're acting confused. They may be talking, not know you. You were in the same room with them and you're part of the family member, but they don't know you suddenly, and they're just acting really strange. Fruity smell on their breath. You know, it smells like
the fruity gums.
Yes,
yeah,
yes,
like
exactly.
Chewing a fruity gum.
Exactly. And so the main thing is watching, you know, how are they acting normally, and if they're not acting normally. And so that one can actually be really dangerous. And so we do want them to know those signs and symptoms to look for so that they can monitor themselves and be able to do something.
And you may have profuse sweating with that as well. So getting your insulin to try to bring that blood sugar down is going to be critical.
Yes.
Okay. Yes. We're going to take a really quick break, and as promised, come back and talk about smoking.
Okay.
Please stay with us. We'll be right back.
Up to 40% of businesses never recover after experiencing a major disaster. Make a plan at ready.gov/business.
Welcome back to complete our discussion talking about diabetes and smoking. Joining me again is Cassie Clayton, the Director of Nursing for Morton Comprehensive Health Services. Let's jump in now. You did an excellent job giving us what we need to know about diabetes, signs, symptoms, danger signs and symptoms, what we can do to try to control smoking. Now, smoking may be as challenging or more challenging. What are you seeing in terms of smoking and in our populations and with youth? Do you see that may be getting better with your clientele? Is it worsening? Adults are getting better? What are you seeing?
I think that it's adults are getting worse, and maybe it's because of the stressors, you know, with the economy or whatever. Maybe it's because of stressors that are going on, and children are teenage smoking. Yeah, that's usually where you try it at. But it's you know, Tulsa, Oklahoma actually is #1 in the nation for a lot of things, and we're not doing so well at smoking either.
Okay.
So it's not getting better.
Okay. Now, there have been so many smoking campaigns and showing people what can happen as the result of smoking, and that it's really not cool and things like that. So it doesn't seem maybe that that's affecting those who are the users as much. Maybe it's preventing new users, I don't know. But what can we do, in your opinion, in terms of trying to impact, especially youth, that smoking is not where you want to start, and if you do, it's why you want to quit? What kinds of things do you sort of teach people or help them with?
I think first of all we need to find out why, and usually, you know, is it peer pressure? And communication is key, you know, in talking with our children. And usually you don't know, you know, but I think in at least giving them the information, and they're getting that information in school, even from younger. They're still doing the experiment with the soap bottle and the cotton balls in it, and learning, you know, what happens with the tar and the nicotine. That experiment that they did a long time ago that they're still doing, which is a very good visual for our children. But I think we have to start young, and especially if they see a family member. You know, if they see a family member, then they think, well, you know, Dad does it, or
so maybe it's okay.
So maybe it's okay. But we have to educate them that, you know, even at a younger age, that smoking is bad for you, and the effects of smoking, and on their level. And children can understand it. It's amazing, you know, when you're explaining on their level what things children can't understand. But I think we need to educate them on their level.
And I think starting much younger is also a key, because sometimes by the time we do officially start, teens maybe already be experimenting or have sort of developed an understanding that maybe that's not as bad as they say it is. But starting very young, like we try to do with eating habits, starting very young so it becomes a routine part of how they grow up and what they think. And sometimes they can say to the adult, why do you do that?
Yes.
You know,
yes.
Which can really help.
Absolutely. As a matter of fact, I have heard children in my family ask, we have a family member that does, and they'll say, why do you smoke? Do you know this is, and they can quote to him, you know, what's bad about it. And so it's wonderful. And I'll say, yes, why do you smoke? You know, so they educate. They actually can educate you, or, you know, family members on it, and I encourage them to. Okay,
now what are some concrete things in terms of the smoking cessation classes that you offer, or that you see maybe across the board, that are critical to helping people understand and to stop? I mean, we hear about nicotine gum, nicotine patches, I don't know, there could be some nasal sprays, I mean, who knows? But what kinds of things do you talk to people about or help them to see that can really help? Because sometimes people will say, I've tried and nothing works.
I think to not give up. One of the things that we have to offer people is that, you know, if you want to quit smoking, if you want to stop smoking, we can help you with that. We have tools that can help you with that, not just information, but being able to come in and giving them information regarding medications that can help them stop, whether that be by pill form, or whether that be the patch, and then support from classes that they could have, one of the classes that we offer, and of course the support that they have from people that are also in the class. Having someone to be able to, it is hard, it's an addiction, and addictions are hard, and so not to make light of how, you know, you just stop. It's not easy as just stopping, and so giving them the tools that they need is, as far as how to stop, is something that we offer.
Okay, and having that medical support, like you said, because there may be some prescriptive medications that can help diminish the craving and help you get to your particular goal, as well as other things that may not be as costly as a prescriptive kind of thing can be helpful. What about people, or have you experienced that people, as they're beginning to stop smoking, start gaining weight? And especially people that may be sensitive to that, who might say, well, I'd rather smoke than to put all this weight on.
Well, we can use that for an excuse, but then you have to decide, okay, what's important, and not everyone gains weight that stops smoking. And so first of all, getting an understanding that that's not necessarily going to happen to you. And I think sometimes just saying, if you trade one habit for the other, you know, I'm putting something in my mouth. Just educating them on that, especially, you know, the ones that are fearful of gaining weight, just knowing not everyone gains weight from stopping smoking. That's something that seems to be handed down from, if I stop, I'm going to get fat. And, you know, so I think that education piece of giving the correct information.
Okay. Now, how important, or do you incorporate this into your class in terms of showing people the long-term effects of smoking? You know, what it really does in terms of damage to the heart or other kind. Do you actually get to that level of visualization?
Very important. Yes, we do. We have, there's 4 classes that there's one a week. You know, we have 4 classes in a month, once every Tuesday, and on Tuesday evenings. And so yes, that visualization. That's a word. Visualization. It's very important for them to have the visual in order to be able to see the effects of smoking, and also giving them information like their lung age. You could be a 27-year-old person with a 97-year-old, lung age. Most people don't know that, so whenever you give them that information, sometimes that comes as a surprise to them, that, how long my lungs are going to last. If my lungs are 97 and I'm only 27, knowing how long my lungs are, what I've put them through, and how long they're going to last. It's very important in giving them that, and also giving them visuals. A lot of times, the visuals are ugly.
Yes.
And sometimes, we need that. But even having the visuals, it's such a difficult thing to be able. It's an addiction that's hard to stop.
Let me ask you this question then. In terms of, once a person stops smoking, what does that do for the lung health?
It improves daily. Every time, for every day that you stop smoking, the lung health improves. Lung health is lungs are one of the things that actually do get better when they stop smoking. And I've heard people say, well, I start coughing when I stop smoking. It's because things are starting to work again that didn't work before. To put it on a very basic level, the lungs are starting to actually move. Things are starting to move in there again that had been covered with the nicotine and tar, and so yes, you might start coughing because things are starting to work again. That's a good thing.
That's a good thing. And other thing really quickly, secondhand smoke, and being able to also, as people often say, people who smoke, they come into an environment where they're kids or other people, they're actually getting some of that from your garments. So they're kind of smoking too, which can end up causing lung cancers in others too.
Yes, yes. Secondhand smoke is just as if I were smoking. It's just as if I were handing you or whoever was in the room with me that cigarette. And especially being on, we don't think about that, being on our clothing and being around children or being around someone who just doesn't smoke. We don't think about that. So secondhand smoke is just as bad.
Okay, thank you so much for joining me.
You're welcome. Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150, or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/Health Alert USA. And remember, look at what's happening. If you have any symptoms of diabetes, contact your doctor. And if you're smoking, think about yourself and others too, and get the help you so richly deserve. Take care. Health Alert is brought to you by OU Physicians in Tulsa.